morning, everyone, and welcome to today's webinar presentation, Cultural Humility in Home Visiting Practice. My name is Sarah Carsley, and I'm an Applied Public Health Science Specialist at Public Health Ontario, and I have the pleasure of co-moderating today's session. Before we begin today's presentation, I'd like to acknowledge and respect the lands, sky, and waters of Ontario, including for their contribution and sharing to support all life within. I acknowledge and respect the treaty, unceded, and traditional territories of all First Nations across these lands and waters. I would like to acknowledge that I'm in Toronto, on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. I acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaties, signed with the multiple Mississaugas and Chippewa bands. Please join me in acknowledgement and respect of all Indigenous peoples, their life journeys and worldviews. May their wisdom always guide our own paths forward with open hands, open hearts, and open minds for the mutual success and benefit of all in Ontario. Lastly, I would also like to acknowledge Daniel Coles, who helped author this land acknowledgement, and thank him for sharing it with us. I'll now mention a few housekeeping items. To enhance the presentation experience, participant audio video has been disabled. The chat pod has also been disabled to limit any distractions during the presentation. Please use the Q&A pod if you have any questions during the session. A discussion and question period will follow the presentation. If at any point during the session you experience any technical issues, please email capacitybuilding@oahpp.ca. I would now like to introduce my co-moderator for today's session, Dr. Susan Jack. Dr. Jack is a professor in the School of Nursing at McMaster University and is the lead of the Public Health Nursing Practice Research and Education Program. Over to you, Susan.
Good morning. Thank you, Sarah. Last year, I had the opportunity to meet Amina when she was a public health nurse at Wellington Dufferin Guelph here in Ontario. And the opportunity to learn and listen and reflect with Amina was a really transformative experience for me. And it was so exciting for me to think about the opportunity to have Amina join us here with PHM Prep to share her knowledge and expertise with all of us who work in really different ways with families and pregnant individuals. And Amina is now in Alberta, in Calgary, and I am a born Albertan, spent my first almost 30 years in Alberta. And this morning when I woke up, first of all, I thought Amina is joining us very early. It's 7:30 a.m. in Alberta, but it also reminded me how relative temperature and weather is in Canada. In Guelph today, it's about -21 when I woke up, and I'm like, oh, it's so cold. And then I quickly looked at the weather in Calgary and it's -23. And I thought, all those Calgarians are thinking that this is a warm spring day because they've just come out of -40 to -50 weather. So Amina, thank you for joining us. And Amina Lizzie is a passionate public health nurse. In addition to her degree in nursing, she also has a degree in neuroscience. She is continuously in her work reflecting on how our environments and relationships really shape how we all move through the world. And that really drives her commitment to promoting cultural humility in both home visiting and general nursing practice and work with families. And Amina has grown up amidst loved ones who were new to this land, and she values storytelling as a form of connection and understanding. And she's intrigued by communication and is constantly pursued by the Duolingo bird. So I imagine you get little beeps every day on your phone reminding you to keep your streaks alive as you learn different languages. And in her free time, she enjoys swimming and hiking and slacklining. So welcome, Amina. Thank you for joining us this morning to share your journey and to provide us with some reflections and context to support all of us on how to really foster more equitable and inclusive healthcare practices. So I turn it over to you.
Thank you so much, Susan. That was absolutely an honor to even listen to you talking about the things that I'm really, really passionate about, and just to be able to share with all of you all my thoughts and my care for the idea of cultural humility. It's something that my colleagues and I talk about constantly. Shout out to Wellington Dufferin Public Health. I miss you all so much. And so just a disclaimer here, of course, we've got our slide saying that this is all my own work. And in smaller writing, you'll see that I included photos in this PowerPoint that are actually my own photos, except for one stock photo. And so they're mostly of my niece and nephew with their parents' permission, of course. So let's get started. All right. Just in the spirit of humility, if there's anything that I say that is misleading or incorrect, first of all, please forgive me. And please let me know so that we can repair together. As I really value the input of all of you, you bring so much richness from your experience to this conversation. And so we're talking about cultural humility in home visiting practice. A lot of this content is applicable across healthcare, as Sue said, and working with families. So please share with anyone that you know may benefit. All right. So as we mentioned briefly, the land that I'm living on today is different from many of you listening. I'm at the joining of the Bow and Elbow Rivers. And of course, some of you may know that as Calgary, which is the traditional territory of the Treaty 7 signatories. And one of the many nations that have interacted with this land and its peoples is the Siksika or Blackfoot Nation. And one Blackfoot expression that I particularly love is ikakimat, which means to try hard or persevere. So we do work that is difficult and often emotional. And it's important to try to have courage and compassion to try hard. And especially when we're choosing to change our ways and improve ourselves so that ultimately we can offer equitable care. And so it isn't really about, I'm going to become culturally humble and that's it. I've done my work and I'm a humble person. When we change our ways, it will be continuously kind of this iterative process where we need to continue to try hard or ikakimat. So if we're to be honest as well to truth and reconciliation, we must actively work towards justice for Indigenous peoples, and that's through confronting any uncomfortable truths or challenging norms that have been established and advocating for change. And so in the spirit of that, I find that it's very important today to focus in on working towards the Truth and Reconciliation's Truth and Reconciliation Commission of Canada's calls to action that pertain to today's topic, which are number 22 and parts of number 23. I'll read them out for you now and you can check them out at a later time. So number 22 is we call upon those who can affect change within the Canadian healthcare system to recognize the value of Aboriginal healing practices and use them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders where requested by Aboriginal patients. Number 23 is we call upon all levels of government to provide cultural competency training for all healthcare professionals. If there are any educators on the line, I really encourage you to take a look at number 24 as well, as it pertains a little bit more to your work. All right. So it's likely that when you hear the term cultural humility in the title of this presentation, that you may already have an idea of what that means and what that means to you in your practice. But I'm going to spend some time today ensuring that we're all on the same page and creating a full picture so that we can then explore some ways that we can improve our cultural humility in practice. And I'd love for us to have some discussions about this. As Sue said, I really value storytelling. I find it very powerful. And so let's talk about how it looks in practice rather than just another webinar on another topic. Let's talk about real examples. So I'm hoping that we can work through some challenges that you've had in your practice to kind of accomplish learning objective number 2 up here. Because of course, you're the ones that know your experiences the best. And so I'd love for us to kind of be able to open up the chat at the end, the Q&A in particular. But I recognize that it might be sensitive. And so, you know, I might think that if I were to tell a story of a time that I did something wrong, I might feel a bit sensitive or exposed in that circumstance. So I just want to give an opportunity for you to do so anonymously. So we'll give you that opportunity at the end. If you think of any stories or challenges that came up in your practice as you were listening to me talk today, please write it down and we'll go through it at the end. Okay. And this is my beautiful niece, Layla. She's adorable. All right, so setting our intention. So of course, we know that working in this field, growth and healing often occurs within the safety of a positive relationship. And we teach that to parents all the time. Right? We explain and we demonstrate how parent-child attachment and positive relationships are the foundation on which children grow. Well, guess what? Children grow into adults that also need the safety of relationship. And so that safety of relationship for adults can provide a stable foundation to be able to share, to be open to change, and to ask for their needs to be met. So we often find ourselves mirroring that healthy attachment relationship with our clients as they navigate creating one with their child. And so this is a beautiful opportunity for us to start building that practitioner-client relationship so that we have a foundation with our client on which to be culturally humble. And of course, cultural humility is going to hopefully feed into creating that beautiful relationship. And so in order to do that, I refer to Dr. Forsyth Carmouche's previous health equity webinar with PHN Prep, where she said to approach with curiosity and assume positive intent. That is the approach that will build that relationship that I'm talking about. And this is my nephew. All right. So let's start at the beginning with culture. The definition that I particularly loved is one that is in a really great document that I've actually referenced at the end of the presentation. It's a journey we walk together, and it's about strengthening Indigenous cultural competency in health organizations. It's wonderful. And so the definition of culture here is that culture represents patterns of being. For, of course, a group of people that you're looking at and how those patterns are expressed. And so culture shapes so many different things in a person's life. You know, it shapes experiences, their perceptions of the world, themselves and others, their decisions and how they interact with other people, including yourselves in practice. So it's essentially how groups of people believe, think, and act. The Indigenous Wellness Framework Reference Guide, which is another thing that I mentioned in the references at the end, has some absolutely gorgeous pages on what culture means in their Indigenous worldview. I really recommend it as well. And so culture, if we think about it, is a zoomed out view of a group. So remember, we're not just talking about ethnicity or geography here. Even though, of course, many cultures have been historically formed due to geography or family ties or social class or ethnicity. But there are many cultures and subcultures. And with communities as well being sustained online and in various ways, we see a lot of diversity today. And so I want you to think outside of the typical box of ethnicity and look at some examples of non-ethnic cultures. I'll just bring a few off the top of my head, things like deaf culture, pop culture, gaming culture. There are so many different cultures. I could go on, and I'm sure you can as well. So sometimes as well, cultures form because of something big that happened to a group of people. Sometimes those things are unfortunately oppression or marginalization or displacement. And so considering the roots is really helpful for us to understand what culture means to a group of people. There are also communities that people often assume are one monoculture, but are a set of diverse cultures, which are put under one label, perhaps by the way we use language, or our sociopolitical context. So Indigenous peoples in Canada, for example, right? This land has so many nations, and they're often put under one umbrella to suit the conversations that we're having, often on a national level. And so that, let's remember that that's not reflective of the various cultures and subcultures that exist and have existed over time. So it's important to realize as well that humans are complex systems. People don't put themselves in boxes. So for example, I think about that someone's trauma from maybe war or displacement can intertwine or inform how they feel about or practice their culture. And it also can inform how their culture has shifted or adapted from those experiences, or even how they introduce culture to their children. Or a person like myself could be a second generation immigrant of mixed ancestry. And so they interact with multiple cultures, not just ethnically, but across cultures that exist within our lives. So culture, again, it's a big picture. It's colored in by collective experiences rather than a set defined thing that is consistent over time. So those details in the picture, they can involve any or all of the social determinants of health. So now we're starting to see, oh, it's relevant. This is relevant to our practice, very much so. So if you thought that we were going to be going through all the ethnicities today and giving tips and tricks about, interacting with each one, I'm sorry to let you down. I'm going a lot bigger picture today. And so we'll be focusing in more on us. And we're going to learn how to be adaptable and, most importantly, humble as we navigate our differences. Just before I move on, there's one caveat I wanted to add. Remember that when thinking about culture, there is no default culture. And there is no neutral non-culture, right? As much as we may accidentally assume so or put ourselves in the position of assuming so, we need to remember that whiteness or any dominant race, right, and its associated cultures is not the default. So, a lot of the time when we're talking about ethnicity, we're like, oh, ethnic people. And I'm sure there's a picture that comes up in the mind of a lot of people, what that sounds like and what that means. And so I want to really look at that with a critical eye and say that there is no default culture. And colonial-based systems are not the default. And so they may, of course, sociopolitically be enacted as the default, and I want to acknowledge that, and I want to recognize how that can affect people. But if we're to dismantle those systemic issues, then we are to notice that there is no default. And that notion, of course, is a reflection of the history of some of the societies in which we live, and that history has included some very discriminatory ways of viewing one another. So let's zoom out together, okay? Let's recognize that no matter where I go, I bring along with me my own cultural views. And so we're going to ask ourselves, how do I hold that? How am I holding my culture and my understanding of how my culture has influenced others, or how their cultures have influenced me, with me as I interact? Okay, so more about that in the following slides. We're going to get pretty deep into those types of reflective questions. All right, I love, love, love this slide, and I'm probably going to be spending a lot of time on this spectrum here, because I find it to be the absolute best explanation of how we can kind of adapt and improve. Of course, with permission from the authors. It's from the document that I mentioned early, A Journey We Walk Together. Again, it's in the final slides as well that you can look at. So I'm going to read the accompanying description that the authors had written. So often cultural competence is explained using a spectrum that shows it as a process that individuals and organizations follow. It's also clear that society's understanding of the concept has evolved over time. Whereas in the past, the discussion began with cultural destructiveness and aimed for cultural awareness, we now start the spectrum at cultural awareness with the goal to become culturally competent, culturally safe, or culturally humble. Okay, so acknowledging culture and providing at minimum culturally aware and sensitive care is essential for beginning to meet those healthcare needs of our clients. And that is the entire reason why we're even talking about this topic today and why it's important. We're at the stage in healthcare where there is so much evidence to say that when we understand a client's full picture, when we're able to know each other, we offer better care that is suited to their needs. And so, of course, I know you all see that in your practice, right? So this includes understanding cultural beliefs around health and illness, and as well as being aware of the impact of cultural factors on health behaviors and health outcomes. But it doesn't stop there, right? So the spectrum continues beyond just a competence and an awareness. It moves along the spectrum towards humility. And so cultural humility means that you're not just acknowledging differences without any action. You're rather changing your behavior and engaging in reflective practice. Hopefully we'll do a little bit of that today. All right, so let's break down the description of cultural competency to get started. So what is competence, first of all? In the document that I absolutely love, again, A Journey We Walk Together, it says that competence describes the ability to do the right thing successfully, implying that the person or organization has the skills to do the right thing and the ability to do it successfully. Competencies refer to the knowledge, skills, abilities, behaviors, and attitudes that underpin the competence. And so skills and abilities, I mean, to the nurses in the room, that sounds pretty familiar. So I'm hoping that we can dive into that a little bit as well. So now that we know what competency is, what would cultural competency actually mean? And so again, from this document, essentially, it means how you act based on what you know and what you believe. Cultural competency requires an alignment of those three things. If you believe and know, but you don't act, you're not culturally competent. And if you act based on not knowing or believing, you're not culturally competent. And so cultural competency requires that you act based on what you know and you believe. That's our starting point today. I put it on the slide for you because I'm aware that perhaps later, if you want to go back, you'd have it written out in a way that hopefully jogs your memory about this conversation. We know that cultural competency alone is not enough because there's more to this spectrum. So I want you to know that competence is important, but it puts a pretty strong emphasis on knowing. And when it comes to something like culture, that implies that you can somehow get to the point of being an expert. And then once you're an expert, you're thinking, well, that's it. I have cultural competence. I'm good. I don't need to do anything to learn more. And that doesn't really reflect what we need to do here. Cultural humility researchers say that that approach can be very, very limiting. That it's wrong to believe that we can master something that is ever changing, especially considering that the ways in which culture shows up in our lives is unique to each person as well. So there may be cultural teachings and knowledge that we can learn, and that's a very necessary starting point. And that helps us, of course, to gain understanding. But the expression of that culture is at an individual level. You are still interacting with an individual. And so it's very, it's a necessary point to start with, knowledge and cultural understanding. But you have to have a conversation about where that person is at and what their perspectives are to know how to best support them on their journey. And so how do we even do that? So to do that, cultural humility, right? We embody that cultural humility. So I want to spend a good amount of time on this slide. Let's deconstruct the definition under cultural humility. Lifelong commitment. Okay, we can ask ourselves, am I really interested? Am I fully engaged? Am I enthusiastically saying, yes, I want to practice with cultural humility? It involves a willingness to embrace and hold discomforts as we see and hold space for a person and their cultural lifestyle and their values. And so it's lifelong. As I said, it changes as people's perspectives change, as culture change. We're all, I like to say, messy and chaotic human beings. And so let's embrace that and continue to learn from one another. Self-evaluation is important. Am I willing to fail? Because I absolutely will. I will embarrass myself. I'll say the wrong thing at some point. And do I have a positive, safe relationship with colleagues or with my supervisor or manager to self-evaluate and self-reflect alongside trusted individuals? Do I self-evaluate alongside the client? Do I show them I have the transparency to hear them out? And do I show them that I'm doing the work? Does your client really know that you're doing the work? And so this goes back to that first slide, ikakumat, to try hard. Don't fall back into comfortable neutrality. It's easy to sit there, but we're doing amazing work. Let's just lean into it and be actively culturally humble. And power imbalances we see as well. So how do I hold my power? If you take just one thing from this entire presentation, please take this phrase, how do I hold my power? I mean, there are so many self-reflective questions that just come out of that. And how do I acknowledge my client's power? Remember that we also shouldn't kind of identify, name a privilege. So for example, like white privilege, and then dominate the space, right? We should name a privilege, but then recognize how you're going to move through that and give back to power in appropriate ways. And I know that's really challenging, but we're up for the challenge. And so how do I give back power that perhaps the processes or systems that I'm in may have taken from the client as well? And reflect on how are the intersections of my own power and privilege with the work that I do? And how am I accountable for any unearned privileges? How might my own maybe disadvantages or lack of privilege in society help me to practice with a sensitive and humble approach? And how do I hold myself as a professional, as well as hold my team or organization and my profession, right? To account for any misuses of power? How do I invite clients in safe and trustworthy enough ways to name any misuses of power? And what structures and practices are in place to make this naming possible and useful, consistently and reliably for every client, right? Okay, I know these are really big questions. We can talk about them later, or even if you want to message me at another time, I'm really happy to delve into this with you. So respect, okay. I believe respect and curiosity go together, and you can't fully respect someone until you know them. Respect being a verb, okay? Until you ask them about their needs, until you're really, really curious. And so you start off with the feeling of respect towards someone, and you should follow up with the action of respect towards someone. So it's through your curiosity, learning about a person, that you can respect them the way that they want to be respected. So I like to say, treat others the way they would like to be treated. So let's make sure we're defining respect in the way that they define it as well. And then relationship. And I have to say, we're pretty good at this. Okay, we just don't get caught into the trap of, I'm too different from them. I don't think they'd want to form a relationship with me, or it's just too hard. Like, some clients are really easy to get along with, and I don't have to work as hard. I know you're not saying it in that way, but in your mind, right? You have that little bit of discomfort. And so really, challenge that and say, ask yourself, I wonder if I'm approaching with curiosity and assuming positive intent. The good thing is that if it's really not working, you can also, and I mean like the relationship with the client's not working, you can model that repair is possible in relationships. You can scaffold onto that with your parenting teaching, which I love. So you can reflect on that with your client when you talk about how children need to reliably see that after a bad thing, like a relationship disconnect happens, that there is predictably relief and repair, and that repair is possible. And if you show that to a child consistently, they can develop strong, positive relationships. That goes back to the attachment research. I would love for you to pick up the book on the circle of security intervention, because that book really dives into that a little bit more, and you'll see how that's all connected. So scaffold your own challenges with your client onto your parenting teaching. It's all relevant. And then trust. It should be mutual. Mutual trust means that you're really showing that you trust the client, because often the client needs to trust us just in the power dynamics and relationship that you're creating with them. But do you show that you trust them? And some cultural humility researchers say that cultural humility needs to also include attributes like openness, self-awareness, putting down your ego, so being egoless, supportive interactions, and self-reflection and self-critique. So I hope what we talked about right now really covers those bases as well. I just wanted to illustrate this even more by giving you an extra slide again, so that you can go back and you can see some different definitions of cultural humility, but I think we really went into it right now, okay? And I want to ask you a question. It feels like something is missing in this spectrum, and that's cultural safety. Why wasn't it included? And so if we think about what cultural safety means, we answer that question. Cultural safety is defined by the client. It's a result, it's an indicator, and it's very unlikely that we will get to competency and humility along that spectrum if the client is reporting feeling culturally unsafe in your care. And so cultural safety is really essential. So how do you even begin to know how a person feels in your care? And the quick answer is you just ask them, right? That curiosity, that relationship where there's comfort to being open and asking. There's also other easy kind of non-threatening ways for people to share. So you can say, you know, for example, I was working with a family visitor when I went into homes, and I could say, hey, you can talk to my colleague anytime. If you feel that speaking to me directly just isn't comfy at the time, they're always there for you. And likewise, you know, if you're noticing anything that in your interactions, or you want to change your goals, or it's just not working for you, please let me know, let the other person know if that's a comfy way of going about it. And usually that's been received pretty well. And so just going back, you know, a provider can't say that they provided culturally safe care unless the client agrees they did so. On a personal note, I have felt unsafe culturally in spaces. And the people in power in those spaces had no idea. And so what I needed is for them to ask, or at least to have an open approach. I needed to know that I could rely on past experiences of being welcomed, and to know that I can kind of expect the same sort of treatment when I come to them with concerns about my cultural safety in their spaces. And so it would have helped that they did their homework in the first place, but repair is possible. And most people are open to repair. You just have to give them the openness to have that conversation in the first place. And so this just gives us a bit more language, you know, knowing now what cultural safety means, to think about our approach and our client's experience. Our job is to provide cultural safety for each client that we serve through our culturally humble approach. All right, what can I tangibly do apart from all these wonderful reflective questions? Sorry. Well, when we kind of think back to what cultural competency and humility mean, we know that we can approach it by bolstering our knowledge, skills, and attitudes, and then embodying cultural humility. Okay. So it can be pretty challenging to have cultural humility as an individual if we're not supported by our organizations in doing so, or if we feel like our organizations themselves are not culturally safe spaces. There's many layers to that. And so I find that the most effective intervention for cultural humility is to start at that organizational level. So let's do that. I've listed a bunch of things that you can look back at, a bunch of ideas for how to work towards organizational cultural humility along that spectrum. And so it's things like hiring, orientation, and performance appraisals. Is having a culturally humble approach included in the requirements? Is it included in interviews? Is cultural competency and humility discussed during performance appraisals? And do we invest time and money into allowing staff to really, truly get to know their communities? Reflective supervision is huge. I'm going to leave that to you as homework to look into what reflective supervision really, really means and how it's different from reflective practice. There are PHO and prep documents for that, so I encourage you to look at those. And safe, effective feedback opportunities. Are there safe complaints processes for the clients and for professionals working in your organization? And does that result in any meaningful change? Does the person who puts in the complaint actually see a result from it? And then, of course, you know, partnerships with communities is super important for understanding and maintaining that relationship. And we can ask ourselves, are those partnerships accessible to frontline staff? Is there communication and sharing among all levels? And I really like this second last point, strong and concrete plans. It's straight from the document where the document, A Journey We Walk Together, where they talk about how you need to ensure that the scope of work is manageable when you're working towards cultural humility in your organization, that you're integrating that new learning into current activities where possible, that you're setting realistic timelines, that you're ensuring that change fundamentals are incorporated, and that you're keeping up the momentum but not burning people out. It's really hard right now with everything happening and everything that's happened over the last couple of years, to maintain all of these changes. And so let's be mindful of that. Now I know this is what you've been waiting for, individual cultural humility. What can we actually do? And so there is an individual assessment in the A Journey We Walk Together document, and Franda and colleagues in 2021 put together a cultural humility assessment. This is really in its research phases. So it's important to kind of look at to get an idea of where we're going with this. But I find that I'll give a little bit of caveats on that. But I think something we can focus on now is working on developing knowledge, skills, and attitudes. So this is the cultural humility assessment that I was talking about that Franda and colleagues worked on. And there is actually a challenge here with measuring humility. And it's something that researchers are kind of grappling with right now. How can you measure humility when a humble person is probably scoring themselves a little bit lower because of their humility? And so they find that it's best actually for the client to, make, judgments on how the practitioner is culturally humble. It tends to be a little bit more valid in these tools that they're creating, but this is just an example. I wanted to show it to you to show that this is both new and old conceptually, and we're advancing in the way that we're trying to measure it. So please don't use this in practice. It's for research purposes at this stage, but I wanted to illustrate what that looks like. Okay, knowledge, skills, and abilities. Let's look at knowledge. So your client should not be your only teacher, okay? They should have the final word about when it comes to how they experience their culture and how they've asked to be treated by you. And I know it's obvious, but it's easy to forget when we get excited, when learning something new, especially if it's new to us about a person's culture, that really they are the expert. And please don't let your client be your only teacher. So keep this list handy so that you can kind of remember that there are, in fact, many ways to supplement your knowledge, both on your own and with your client. I particularly love life history timelines. That's another PHM prep webinar. And you can really incorporate culture into that if it feels relevant for your client. I did want to make a note on emotional labor and kind of making someone a spokesperson. So sometimes when someone asks me about my culture, and if I can tell that I'm their kind of only information source, I really worry. It makes me unsteady knowing that I may be not giving a proper explanation. Am I representing my culture appropriately? It can be very intimidating and it can put a person on the spot. So, and then of course, it's even worse if you question their understanding, especially for those living in a diaspora in Canada or second or third generation immigrants. Like it's a challenge. We often hold multiple identities. And so how do we navigate that? 3 things. One is allow people to say, I don't know. Number 2 is ultimately you need to be humble when asking people about their culture, and you need to communicate that they're not your only information source. And number 3, please, please, please thank them. Thank them for their energy, put into teaching you if they chose to do so. Say something like, wow, thank you so much. For the kind of time and energy that you put into showing me this part of your life. I'm honored and I'm really excited to get to know you even better. And then, some more tips for the knowledge piece is asking for feedback from clients, colleagues, mentors, people in your life when you're starting to learn more about a client and their cultural views. Please understand anti-racism, how this interacts with all of these pieces and what that means for you and your positionality. And then recognize that language is not the only barrier. Okay, understand the difference between straight translation and cultural and language interpretation. So some words don't even exist in languages. Some concepts don't even exist across languages as you try to translate them. So how are you navigating that together? And often you'll see clients to navigate that, they will ask their family members to interpret, because they're not just providing a straight translation. They are embedded in their own often cultures as well, and will culturally explain things, right? Like in a way that makes sense for that person in their context. So being kind of open to that and recognizing the pros and cons of having family members interpret, and supplementing that as best you can with the family, and asking them what their goals are for the best communication possible between you two. Attitude. So I do want to kind of just leave this slide for you to read later, because I know we really went into it a lot in the previous slide, but I just wanted to leave it here to remind you and write it all out for you. I did want to just touch on that last point about commitment to providing optimal care. If a visit takes 1.5 hours because of the slow interpretation of the cultural interpretation, then it takes 1.5 hours. That's equity, right? I need us to start to figure out ways to build in flexibility for that, because then ultimately you're offering the type of care that you would have offered someone else if there weren't those barriers in place. Okay. Skills. So skills are a lot of things that we actually are already familiar with, which is fantastic. We're scaffolding that cultural humility on top of things like trauma and violence informed care, on top of things like reflective practice, like our assessment skills and our advocacy and our motivational interviewing. You can weave in cultural humility with all of those pieces. And so something that I wanted to just touch on before I move on from this slide is that the way that you manage power imbalances is super important. I know we really looked at power before, but it's, I would say, the deciding factor that helps people decide if you are a culturally safe person and have created culturally safe spaces for that individual. There's also something I added in there called social scripts. And social scripts is essentially giving someone the language to overcome a barrier. So if it were something like me giving a client a social script, it could be something like, I wonder what you'll say to communicate your needs when you go to your doctor. And then they tell me what they think. And I say, my understanding, could I offer, would you be open to me offering kind of the language that I might find useful? Because I know that, family physicians often would want to understand it in this way. So I would go to my family physician and say, I need X, Y, Z. So you're teaching basically medicalese to clients. And so another way to use social scripts, not just with your client, is to use it with your colleagues. So if your colleagues are having a hard time with an interaction, and they're kind of coming to you for reflection on it, you could give them a social script. Say, I would say this. So I would say something like, and I pulled this from the CAMH Immigrant and Refugee Mental Health course. It's awesome. Please, please, please do it. There's a social script where it says, in your culture of origin or in your family, how would you have addressed or resolved this issue we're discussing? That's a great social script to hand over to a colleague or to use for yourself. Okay, so I love social scripts for that reason. All right, this is the fun part. So when it comes to talking with your peers about cultural competency and hard conversations, I encourage you to not call people out, but call them in. So I'm going to call you all in, hopefully right now, to share your stories. And again, I have to reference Melinda. She presented this, and I asked for her permission to give this quote again in this presentation because I find it so relevant. And I hope you saw today through what I was discussing that a lot of the webinars that we've done, over the past months, They all tie in together, and I hope you can tie cultural humility right into all of those other ones. So please go back if you've missed some of the previous webinars. I want to know from you, what are some scenarios that you've come across that you said, I feel stuck, or I feel like there's a misunderstanding here, or, there's some sort of cultural practice that is just, I don't know, like we feel stuck. Like maybe it's making decisions about their child's care, and it's based on their culture, and I'm not understanding that choice, or it's a closed practice, I'm not being let in. Like, what are your challenges? Tell me stories. Let's work through it together.
Amina, thank you so much for joining us today. And it is a short period of time, and you've provided some excellent guidance. I'm excited to work with you to develop a practice guidance resource, and I hope we'll add some of that social scripting. And I think one of your messages today is that this is a commitment to learning and growth for all of us. And in the words of Walt Whitman and Ted Lasso and Amina, the reminder to always be curious, non-judgmental, and to ask questions. So thank you so much for joining us today and for sharing your experiences. For those who are still joining, there is an evaluation. If you could, a link, you'll receive a link, complete the evaluation. And I hope you'll all join us on February 14th when Dr. Elizabeth Keys joins us to talk about practices with respect to infant sleeping. And that registration will be out soon. So thank you, everyone, and have a lovely day. Stay safe, keep warm. Take care. Bye-bye.